So with the hips and the sacrum, it's the platform that obviously the rest of the spine sits on. So there's two hip bones on either side. You can get into the details around which ones are which, ischium, ilium, etc. But for our purposes, we'll just sort of talk about it as one complex, or hip bone for now is good. This is where that femur plugs in, the ball and socket joints. You can see it's quite a deep, profound socket, so that's why it's a very stable joint. It still needs to be quite mobile. Some of the things we want to be very aware of is the anterior superior iliac spine, which means there's an inferior one or a smaller one, lower one down here, but it's that top one that we can feel. That's that hip bone right up in here that we can find. The other one's deeper into our muscle and harder to find. But we want to be aware of that because our anterior superior iliac spine is directly above the whole of our socket. So that's where the hip joint actually is. Anterior superior iliac spine, directly inferior, directly down. That's actually where the ball and socket joint is. That's your actual hip joint. So when you're lining up your postures, you want to use the ASIS, or anterior superior iliac spine. There's also a posterior one, or one on the back. So some people have little dimples back in here. Sometimes you can feel that little bone, sometimes you can't. Just depends on your tissue. The anterior superior iliac spine, ASIS and PSIS, posterior superior iliac spine, need to be approximately level. We tend to have ASIS drop too much, which you can see puts a lot of tension on the spine. If your head's kind of going up and you tilt your pelvis forward, it really pushes on this part, really compresses down here. Who doesn't have low back pain down in this region? And or some people go too much the other way and ASIS lifts and it starts to bend the spine the other way. That's that hunched posture that we spend all too much time on, computers, technology, driving, etc. So ASIS, we need to have alignment for our foot placement in Tadasana and or standing postures. PSIS, we need to be aware of for our pelvic tilt. Another way you can think of the pelvic tilt is the bone that joins the two hips together, because again we have two of them, sacrum in the middle, kind of like a hand-shaped bone, kind of sits in between and actually joins the two. Theoretically, for a lot of people it's fused, some people it's a little mobile. Doesn't really matter if there's a lot of movement unless there's too much. Doesn't really matter if there's no movement unless it's actually fused too rigid and you can't actually move it as a unit. But in general, we tend to talk about moving the hips as a unit together. The thing about the sacrum is to get rid of that compression in this low back here. The sacrum's always dropping, always pulling down towards the earth. You can see that takes ASIS and PSIS not really in alignment now. If I get the sacrum to drop or kind of pull down, now it opens up the pressure and levels out the hips. Tip of the tailbone is right at the bottom of that. So the coccyx or tailbone sits at the bottom of the sacrum. You can see there's still lots of nerves coming out through the sacrum there. And so you really want to have that dropping. This is really, if I hold just the sacrum, I can support the entire spine all the way up to the head. You can see my spine here needs some adjustments, but good chiropractor can fix that. So if I hold there, that's literally what everything sits on. So when we move from the sacrum, we turn from the sacrum, we lunge from the sacrum, we bend, and the sacrum supports us in our forward bends, back bends, etc. So everything comes from the sacrum. So make sure you hold your sacrum steady. It's always dropping towards the earth. ASIS, PSIS. Spend a little bit of time maybe on the pubic bone too. It's here in the front. That's the front fusion point. And when women are giving birth, that actually opens, sometimes actually separates completely in order to increase the size of the pelvic outlet or allowing babies to pass through. You can see the coccyx is kind of in the way, so sometimes that gets involved a little bit too and or becomes sore or damaged. So another cue you might hear from people is tip of the tailbone goes down, the whole sacrum drops to level off the pelvis, PSIS, ASIS, and the pubic bone's there in the center. So you can also use that as a reference point as well in terms of where your alignment is, or sometimes pelvic tilts, people reference pubic bone coming up or sacrum dropping down. Just good to know where both parts are as we work through the hips, two bones, as well as the sacrum.